Hello everyone. In this particular session, let's walk through how ventricular pressure behaves over the course of full cardiac cycle, a step by step correlating with each point with what's happening mechanically inside the heart. So we begin with the ventricular diastole. So at this particular point, the ventricles are relaxed and filling with blood from the atria. As blood volume slowly accumulates inside the ventricles, there is a gradual rise in the ventricular pressure. This is point A on the curve. So this increase is very small because the ventricle is highly compliant during filling process. And just before systole begins, you could see there is a small hump in the pressure trace, that is point B, which corresponds to the atrial systole. This is the topping off phase of ventricular filling where the atria contract to push the final portion of the blood inside the ventricles. Now, systole starts with isovolumetric contraction. The ventricles contract, pressure inside the ventricles rises sharply, and the AV valve snaps shut, which represents the point C. So, to prevent backward flow into the atria, the valves are closed. So because all the valves are closed at this particular stage, after the closure of the atrioventricular valves, the volume stays constant but the pressure climbs rapidly. And when the ventricular pressure finally exceeds the pressure in the aorta for the left ventricle or the pulmonary artery for the right ventricle, the semilunar valves open, which represents the point E, making the start of ventricular ejection. Blood is then forcefully expelled into the greater arteries, which represents the point F, causing a rapid pressure peak. So after ejection is completed, the ventricle begins to relax. Once the ventricular pressure drops below the pressure in the greater arteries, the aortic and pulmonary valve closes, that is point G, which represents the protodiastolic period of the cardiac cycle, producing the second heart sound. This signals the start of isovolumetric relaxation, during which the ventricles still closed chambers but their pressure falling, that is the point H. So as the ventricles continues to relax, the pressure inside them eventually falls below the pressure in the atria. At this moment, the AV valves open, which is the point I, and ventricular filling begins again with the starting of the next cycle. So this is all is about the ventricular pressure changes during the cardiac cycle.